Well, the weekend brought the largest daily increase in cases since the pandemic began. And today the World Health Organization is warning too many countries simply are not doing as they're being advised. It's reiterating the need for basic measures to be implemented.
The only aim of the virus is to find people to infect. Mixed messages from leaders are undermining the most critical ingredient of any response: trust. If governments do not clearly communicate with their citizens and roll out a comprehensive strategy focused on suppressing transmission and saving lives, if populations do not follow the basic public health principles of physical distancing, hand washing, wearing masks, coughing etiquette, and staying at home when sick, if the basics aren't followed, there is only one way this pandemic is going to go. It's going to get worse and worse and worse.
Well, America is by far the worst affected country. Florida's now recorded more cases in a single day than any other US state. 15,000 is the figure. That's higher than one day in April in New York State. To put this in context, if Florida were a country, its one-day statistic would rank 4th after the US, Brazil and India. While dozens of Florida's hospitals have intensive care facilities at full capacity now, Peter Bowes has more.
When the pandemic started, Florida was slow to respond. The beaches and bars stayed open. They were eventually forced to close, but reopened early, only to be shut down again. This is a state dogged by the disease and confusion over how to deal with it. Even as the numbers rose over the weekend, Disney World opened again to the public, Mickey Mouse at a distance, and mandatory face masks for visitors.
Well, as you can see there, Florida is trying to get back to business, and that's including Disney World and Orlando reopening. David Begnaud from CBS News has more on that.
Just in Orlando, where we are, where Walt Disney World is based, the test positivity rate is near 14%. Now, experts here in the U.S. say it should be near 5% before places start to reopen. But Disneyland and others are moving forward because, again, you have a governor here who is a very close ally of the president, who is saying we're not rolling back anything. We are moving forward, but we are doing it cautiously. Florida has a high population of elderly people who come here because of the sunshine, the lower taxes, and that's why they live here. So you have a population that is much more vulnerable here than, say, maybe elsewhere in other states. However, it is worth noting, the average age of the person getting sick and infected right now is very young. In fact, it's around 21, 25 years old.
Well, while the virus spreads across the US, in Washington, the White House is briefing against the infectious disease chief, Dr Anthony Fauci. On Sunday, an official shared a list of comments that he'd made earlier on in the outbreak with the view of highlighting that some of them may have been inaccurate. More evidence of the collapse of the relationship between Dr Fauci and President Trump comes here. He's told the Financial Times that the last time President Trump heard one of his briefings was the 2nd of June, and given America's situation has deteriorated since then, that's quite a time to stop listening. Here's more on that from Julia Manchester from The Hill.
So essentially, the administration last weekend sent out opposition research, if you will, something political campaigns normally send out against their opponents, saying they don't necessarily want to listen to Fauci because he's been wrong on so many things, according to the White House. They state that before masks became really a thing in the United States, he was saying that he didn't think people should be wearing masks at that point and such. So it's interesting to see how they appear to be treating Anthony Fauci as more of a political opponent than someone who's very much a part of President Trump's coronavirus task force. But you're still seeing Anthony Fauci making himself very accessible to journalists and the American people, doing a number of interviews with media outlets.
Well, a little earlier, President Trump said he had a very good relationship with Dr Fauci, but doesn't always agree with him. And in the last hour, California's governor has announced the shutdown of all indoor venues, including restaurants, bars and cinemas. In parts of the state, churches and gyms will also have to close. That's to do with California's rising rate of infection. Texas is another state under pressure. A doctor in the city of Antonio has spoken about a man who thought that coronavirus was a hoax, but subsequently died from it. Here's the doctor in question.
We cared for a 30-year-old patient at Methodist Hospital who told their nurse that they had attended a COVID party. This is a party held by somebody diagnosed with the COVID virus, and the thought is that people get together to see if the virus is real and if anyone gets infected. Just before the patient died, they looked at their nurse and they said, "I think I made a mistake. I thought this was a hoax, but it's not." This is just one example of a potentially avoidable death in a young member of our community, and I can't imagine the loss of the family.
Well, the US is seeing rising infection rates, so is Brazil, so is Colombia, as you can see, India and South Africa too. Let's look at them. South Africa has reintroduced a ban on alcohol sales, a nighttime curfew has also been imposed, and wearing masks has been made compulsory. Here's Pumza Fulani in Johannesburg.
Alcohol is no longer available for sale in South Africa. It was also illegal to be found transporting alcohol. This would be in the event that you already had alcohol in the house and you were trying to move it elsewhere. If you're found transporting it, you could also face arrest. The president says this decision, although difficult, is necessary. He pointed to the situation in South Africa's state hospitals, particularly that which have become virtually overwhelmed, saying they are now at a place where many of them are having to turn people away because there isn't enough space for them, and that a number of people that are in those trauma units are people that have come in as a result of alcohol-related injuries, and they need to take this decision to try and take some of that weight off.
Well, India has seen yet another record for the number of confirmed cases in a single day. More than 28,000 were reported on Monday. The national total is coming on for 900,000. This is the fourth consecutive day India has recorded a daily increase over 26,000. The government there says it's providing medical support for everyone who needs it, but there have been reports of people being turned away from hospitals. And we know that for those who can afford it, one option is increasingly to be treated privately at home. On that, here's the BBC's Nitin Srivastava.
A residential apartment block in a wealthy Delhi suburb. It's home to more than 600 people and an isolation ward for COVID-19 patients. The government has increased bed capacity, but patients like Mr. Mehta prefer their own facilities like these.
After testing positive, I went to a government hospital, but decided not to get admitted because of the excessive crush and overcrowding. We didn't panic as a family and opted for home isolation with a mini ICU kind of setup, which really helped me.
This is an oxygen concentrator which provides you oxygen for 300 hours non-stop on power backup. This is a cardiac monitor which is right now monitoring my oxygen levels, my blood pressures and all other vitals. And this is a ventilator for a worst case scenario. Whilst buying services like home ICU and isolation beds is becoming more popular amongst India's elite, the majority of patients do not have that option.
Well, while overcrowding in city hospitals is a growing problem in India, there are concerns that the country's lockdown has had the unintended consequence of spreading the virus throughout the country as it forced migrant workers to return to their home states from the cities where they had been working. Dr Brahma Mukherjee is an epidemiologist at the University of Michigan.
The disease has spread all across the nation. From the initial cases in the West Coast and Delhi and the bigger metros with the mobility of the migrant health workers, as well as the reopening of the country, it is now in the eastern and the southern states of India. I do not think a re-lockdown of India is feasible. So it depends on what metrics have we been able to achieve. So I think the implementation of the lockdown due to having limited time for the migrant workers caused increased mobility. So the disease has really spread across the country now, and less than 1% of people have been tested.
Now, a demonstration of how pervasive the virus is in India is how it's affected 3 generations of one of Bollywood's most famous families. Amitabh Bachchan revealed to his millions of Twitter followers on Saturday that he was in hospital with COVID-19 along with his son, Abhishek Bachchan. He's now revealed that his wife, the actress and former Miss World Aishwarya Rai Bachchan, and their 8-year-old daughter have tested positive too. BBC Asian Network's Haroon Rashid has more on this.
Amitabh Bachchan is considered the greatest actor of all time, not just in India, but according to a BBC poll conducted trying to find the star of the millennium, he was voted the greatest actor across all industries. And he's the head of a Bollywood dynasty, as you mentioned. His son Abhishek Bachchan, an actor in his own right, Aishwarya Rai Bachchan, one of the most successful actresses of the last 2 decades in Hindi cinema as well. Amitabh Bachchan also with billions of fans across the world.